The LiteLift is a modified facelift that can be done in our office under local anesthetic. The LiteLift has shorter incisions, it's less invasive, and has a much quicker recovery time. Our best candidates are those patients which typically are in their late 30s to 60s. That is, those patients with good elasticity of their skin. However, we rely more on good health, that is physiological age and not chronological age. So even if you're in your 70s or even 80s, early 80s, and you have excellent health and you're not on a bunch of heart medicines, haven't had a heart attack, and exercise daily, we'd much rather operate on a patient like that than someone who is far younger with lots of medical problems. And they also enjoy some wonderful results from this procedure.
Well, I always felt young. I just wasn't looking young. So I'm 63, and you know, some days I feel 63, but most of the time I feel young 50. A friend of mine had it done, and she looked fabulous. She just said she loved the results, and she said it was an easy procedure, so I figured if it was easy, I could do it. And she looked really remarkably great, except for she looked the same, which is what I wanted to have done. Just look better, but not change the way I look. What I saw in the mirror before I had it done was a face that was aging and hanging, crepey. I had lost my chin line, which I didn't have much of anyway, and it was getting difficult to put on makeup. So I thought if they could just lift all that up, it would be perfect, and that's what they did.
The LiteLift operation is different than a traditional facelift in several ways. The traditional facelift is the operation that all plastic surgeons learned how to do during their residency. Most plastic surgeons continue to do the same operation. Our patients came to the office and said, we want to have an operation that's an easier operation that looks natural, that doesn't have a windswept look, and is more affordable. We changed our technique in a number of different ways to meet the needs of our patients. LiteLift has shorter incisions, can be done in the office under a local anesthetic, and the recovery is usually only 5 to 7 days.
I think the best thing about having the LiteLift for me personally was just, you know, being able to look the age that I felt. It's like I don't mind growing older. I mean, that's the good news, that you do get to grow older. But you don't want to feel like, you know, you're a grandma, you know, already. You know, I called it the wonder years. You start wondering how you look, you know, with a facelift. And I was doing that a lot. I saw a lot of sagging, and I had bags under my eyes, and I just felt like I looked a lot older than I felt. The big deal was I didn't have to go to a hospital. I didn't have to be under completely. I could just be given the happy pill, as they say. It could be all done locally and in the facility itself, and it would only take you know, several hours to do it, and I could go home, and there would be less recovery time too. So those were the big appealing factors to me.
And I answer this question in two different ways. The first one is, and many of you will roll your eyes back when I say this, is that it'll last forever. And I love to use the identical twin analogy. Let's say that you had an identical twin, and that one of you had, let's say you, for example, had a facelift, a LiteLift, and your twin did not. Well, from that time forward, you will always look younger than your identical twin. 5 years from now, 10 years from now, or 20 years from now, you'll always look so many years younger. But that doesn't mean that you stop the clock of time and normal aging. You don't jump on the clock and break it. It keeps on ticking. So that in 5 or 10 years, you'll look 5 or 10 years older rather than you did right after you recovered from it. So you'll always have those long-lasting effects.
When I look at myself now, I think how fortunate I am to have had the LiteLift, and that I can go out in public without feeling like I'm tired, and I feel my face is much brighter now than it was before. I was getting jowls, and that was like a shock. I don't look like I used to look, and that bothered me. And also, my neck was bothering me. I could see that signs of aging were there in my neck, and also in my cheeks. So that was all tightened by the LiteLift. A lot of my friends said, that's the best thing you've ever done. And I wasn't embarrassed, you know, to say what I had done, because, you know, I just wanted to feel better about myself, as we all do. It's really nice to come to an office where the doctor really sits down with you and discusses everything and answers all your questions. He really is very honest, and I think that's a trust is a real issue. And I felt like I could trust anything that my doctor said.
Many patients come to the office and they're concerned that the facelift will leave them looking too tight, too pulled, or with a windswept look. The LiteLift, the way we perform it, leaves our patients looking natural. The muscles are tightened, but tightened just enough to give you a very natural appearance, but correct the neck and the face that most patients want to have changed.
When I would look in the mirror, I felt like there was almost a sadness there, because no matter what I did as far as putting makeup on to kind of give myself a fresh look, it just wasn't happening. For me, I didn't feel that I needed a full facelift, because there were just areas that I wanted to focus on. I preferred a less invasive type of surgery. I liked that it was, you know, just under a very light type of sedation, and you didn't have really any of the complications that you might if you truly go under. The area of concern for me was underneath my eyes. When I look into someone's eyes, you know, they can just tell so much about that person. And I felt old and haggard and worn, and I just thought that's not reflective of me. I feel like I'm 40, and oftentimes I've had people come up to me, and especially when I've been with my daughter, and they think that Jill and I are sisters. And you know, sometimes I feel bad for Jill because I don't want her to feel that she looks older, but I feel that I look like I feel on the inside, which is what I wanted.
Another common question that's asked is, how long is recovery? And this actually varies from person to person. Some people tend to bruise more than others. Others tend to swell more than others. And so there's a wide range of what it takes. However, the recovery is accelerated tremendously from a traditional facelift, about half the time. So typically I tell my patients 1 to 2 weeks they should be ready to be able to go out in public. If you have more than one procedure, like for example, say you had a LiteLift and you had your eyes done, a blepharoplasty, and you also had a chemical peel, like a blue peel, that would probably increase recovery time by not too long, but maybe 3, 4, 5 extra days. But typically people recover very fast, and with light cover-up makeup are able to go out in public in 1 to 2 weeks.
It's basically the rested look, and I think that's what begins with lifting as we age and we lose collagen, as it begins to sag a little bit. Then as you not tighten up to that Joan River point, that you get just the lift that it is, the LiteLift that it's called. So. And I love Joan Rivers, trust me. As with all women, we were in the mirror and say, well, what would it be if this happened? What would it be if that happened? And, you know, if I just didn't have these marionette lines, maybe something like that would be nice, and it would just add a touch of youthfulness without being severe. The areas of concern that I was when I came in was mostly my neck, because facially it was like still not ever quite looking my age, But it was like, okay, so when I saw Dr. Horowitz, he said, well, we'll work on this. And then with the marionette lines, and then pulling back, told me exactly how the scars would be and where they would be, and then just some light lifting, again, just so that you look rested. I think it's an opportunity to use your money wisely and still have a desired outcome of having fewer wrinkles, a better rested look that they do talk about, and the fact that scars are not going to be an issue generally. Even with various hairstyles, I'll wear a baseball cap. You really don't see any scars per se, and I think that's really also important. And just being able to have that advantage of just that little extra youthful look for a little bit longer period of time.
Local anesthesia is perfect for most of our patients. However, because we are board-certified plastic surgeons, our patients have the option of having a twilight anesthesia or even a general anesthesia if that will make them feel more comfortable. Dr. Horowitz and I have been performing this procedure for the past 8 years, was the first one I did, with increasing frequencies. We do approximately in the office 3 to 5 of these LiteLift procedures per week. We've been performing facelift procedures, however, for more than 25 years, and we're just thrilled to be able to offer you a lot of the new advances that we've helped modify and improve upon a long-lasting result through a minimally invasive procedure. And we hope you learned a lot about the LiteLift, and all of your questions were answered today. If you have any more questions after this brief introduction, call the office or make an appointment to see Dr. Nichter or myself or one of the consultants.
Don't wait too long. I mean, do it right away. It's a very easy procedure. Recovery was fast, no pain. So I would say go for it.
Oh, I feel like I'm in my 50s, and most of the people I meet are, I've seen, they say, oh yeah, you look at least 10 years younger. So it makes me feel very good.
It's like you come here and you feel like you've gone to visit family, which is nice. In my opinion, I still look like me, only just a rested me and fewer wrinkled me.
The main thing is that I looked like I was rested and that I looked younger. And we all want that, especially when you get to be this age.
I couldn't be happier. I should have done it a long time ago.